The surge in cases has placed significant pressure on our public hospitals, with 89% of isolation beds and 67% of ICU beds occupied. This strain is also why COVID-19 restrictions have been extended for 4 weeks. What is it like being in a ward dealing with the current burden on hospitals? Well, joining me is David Allen, an associate professor from the Infectious Diseases Translational Research Program at NUS's Yong School of Medicine. Now, he's also an infectious diseases clinician who cares for COVID-19 patients. Welcome to the show, Professor. Professor, tell us, what is the situation in hospitals and the strain the healthcare system is under?
Situation in hospitals is they're functioning. They're doing the tasks that are before them. There's a sense of camaraderie and purpose, and that's what's going on in the hospital. It's certainly busy, but it's not busy with the usual activities that, say, would have gone on 8 months ago.
And, you know, with regard to the strain that Minister Yong mentioned yesterday, could you paint us a picture of what that strain is that the healthcare system is under?
Well, the healthcare system is designed to care for all the usual needs of Singaporeans and those who access the hospitals, the day-to-day issues, the issues that can be managed electively, and the issues that need to be managed urgently. So when there's COVID that is utilizing more of the hospital resources, then efforts need to be focused toward addressing that. And some of the less urgent or elective items don't get handled quite so rapidly, expeditiously.
Professor, Minister Ong also mentioned yesterday that there are currently 200 ICU beds for COVID-19 patients. He previously said that up to 1,000 beds can be made available. Do you see a need to increase the number of beds given the current situation?
Well, it is a very fluid situation. There are steps that have been taken to try to mitigate the current requirement for beds. And those things are trying to get people isolated, do the usual social distancing, hand washing, etc., and also taking care of patients that don't need to be in the hospital, either in their home or a facility outside the hospital. So it's hard for me to say specifically the kinetics. I can see on the Ministry of Health website and in my own facility the day-to-day fluctuations that occur in the need for ICU beds. So do I see a need for the number of beds going up? Yes. Will it be 1,000? I don't know. Will it be 300? I don't know. Will it drop down to 150? I don't know. This is the dynamic state of affairs as it is, and we need to be flexible and able to respond quickly.
Professor, let's talk about the current restrictions that have been extended. Do you think the continuing restrictions should be differentiated to protect unvaccinated people, yet allowing more leeway for those vaccinated?
Well, that's an interesting question. Personally, from an infectious disease perspective, and I am an infectious disease physician, I would say yes, because we know those steps, or we feel strongly those steps will decrease transmission. If we know that people being vaccinated decreases both their risk of developing severe disease and of the subsequent need for hospital care. We know that it decreases their chances of transmitting the virus to others. So these measures are put in place to try to prevent them, number one, having a need for hospital care themselves, and number two, transmitting it to others that subsequently might need care in the hospital, and increasing demand on our resources. So I don't personally have or professionally have a problem with this, particularly when increased transmission will lead to, in those unvaccinated or those vulnerable, will increase demand on our finite hospital and ICU resources.
18 deaths recorded yesterday, the highest in a single day. Now, all except one had underlying medical conditions. Professors say I'm an elderly, vaccinated patient, but have medical conditions. What sort of factors would put me at the greatest risk of dying from COVID-19?
Well, there's a variety of situations we know that are associated with an increased risk of dying from COVID-19. Number one is vaccination status. We know those who are vaccinated have a significantly lower risk of severe disease and death. We know that age correlates. The higher the age, the greater the risk of complication and death associated with COVID. We know a variety of other conditions. We know that males have a higher risk of severe disease than females. People with chronic conditions, as you mentioned, whether it's diabetes, cancer, or heart disease, are at increased risk. So how you weigh which one has more or less risk, it kind of depends on how the groups you analyze, but they all contribute. And in reality, most people have more than one, in the sense I may be old and with diabetes.
Well, thank you so much for your insights and your perspectives, Professor. I've been speaking with Associate Professor David Allen, NUS's Yong School of Medicine.